Good morning, and thank you for coming. My name is Ginny Schubert, and I will come right out and say I'm not a researcher. I'm more on the knowledge translation end, and I am honored to be here representing my colleagues from Housing Works, a nonprofit organization located in New York City, and University of Pennsylvania. And we have had for a while now a very productive community-based participatory research partnership. And one of the things that we've been looking at, Housing Works is a large nonprofit organization in New York City that provides a range of services from housing for formerly homeless people, medical services, substance use and mental health care, so a full range of services. And we've been looking for a while now, and we also have a very strong advocacy arm. So we've been looking for a while now with partners like the U.S.-based National AIDS Housing Coalition, and I would encourage you to check them out for more information on housing as a structural intervention to support treatment and prevent new infections. This presentation I'm doing today looks specifically at housing as a structural intervention for transgender people living with HIV. In New York City, we actually have fairly good research data on prevalence among transgender members of our community, and the prevalence rate in New York, the prevalence rate overall, as you know, is very high depending on the community, and this one citation we have shows a prevalence rate of 27% or almost 28% among transgender persons, and in New York it's even higher in our transgender community. And as we all know, that's a result of a series of interacting and complex risks that are mutually reinforcing for this particular at-risk population. As we know, transgender persons and transgender and gender non-conforming persons experience stigma, marginalization, discrimination that impacts on their access to education, employment, health care, housing, social services. One of our residents talked about needing access to substance use treatment, and the drug treatment program had literally no place to put her in their facility. So there are material consequences of this marginalization that are expressed as a high risk of unemployment, homelessness, incarceration, and the resulting exposure to this risk environment results in a loop of further marginalization and discrimination that just feeds back as for increasing social marginalization. And one of the expressions of this marginalization is unstable housing, economic marginalization, inability to access employment, exposure to transphobia, and gender abuse. And so, as we all know, this is a complicated risk environment. We believe at Housing Works that addressing risk requires complex and multifaceted approaches. The research in this area has called for multi-component interventions that can address the full constellation of service needs of transgender and gender non-conforming individuals, and increased intervention efforts that are focused on structural barriers facing transgender individuals, such as housing. The rate of homelessness among transgender persons in New York is extremely high. Also, what is lacking in almost every service environment are trans-competent and trans-specific services. And what we found when we started to look at Housing Works' unique transgender housing program was that there was very little research examining structural interventions of any kind that are responsive to the complex and unique needs of transgender and gender non-conforming persons. The Transgender Transitional Housing Program at Housing Works is a program that was specifically tailored to serve transgender and gender nonconforming persons who are living with the virus. It's a scatter site model, which means that each resident lives in her or his, we have one female to male transgender resident, own apartment in the community. It's a use-tolerant, low-threshold model, so commitment to abstinence from substance use or a particular treatment plan is not a requirement for either accessing the housing or remaining in the housing. And while residents are not required to participate in services as a condition of continuing their housing, they have access to a full range of services that include case management, groups, access to trans-sensitive medical care provided through Housing Works, and a full continuum of other services. I actually wanted to, and there are a range of other services at Housing Works that our trans clients have access to, including a 25-year-old job training program that's been highly effective in bringing members of the clients of Housing Works into employment at Housing Works. I think 25% of our staff members are former clients. It's an important part of empowerment in our community. And I actually wanted to recognize Paris Milan, who's in the audience, who worked for the, stand up Paris, who came through the Housing Works job training program, worked for 2 years in our transgender housing program, and now works in another housing program that we operate in Harlem for individuals and families. I'm not a researcher, so I'm going to skim over the methods, but as I mentioned, it's a community-based participatory approach. We've tried our best to ensure meaningful involvement of residents and staff of the program in developing the research questions, developing the tools for conducting the research, looking at the results, and deciding on action strategies for translating the results into advocacy for more housing and services. It's a mixed method approach. We compared 90 residents of the transgender transitional housing program, and let me just say, transitional is a very loose term. It's dictated by funding, not by the reality on the ground in the program. So clients are able to remain in the program for as long as they need to until they're ready to move on to another housing situation. So residents have been in the program a range of time from a few months to many years. So we compared 90 TTHP residents who had completed the program, who were assessed at program exit, to 90 Housing Works homeless HIV positive clients who were also on HIV medication. All of the residents in the program are at a stage of disease where they are appropriate for and have access to ARVs. We did multiple regression to assess the independent effect of the participation in the TTHP program on viral load. That was our main outcome that we were looking at. And we also did in-depth semi-structured interviews with all of the current residents of the program to try to understand the quantitative results better. We're very pleased to say that residents in the TTHP program was associated with significantly associated with viral suppression. A significantly higher proportion of those who completed the TTHP program had suppressed viral load, 67%, compared to non-residents, 32%. And I also want to say that this is all going to get even better, because in Housing Works we've just started our undetectable program, where we're providing a range of supports, including cash incentives, to enable people to achieve and sustain viral suppression. So we hope to be able to report an end of AIDS in our community through a high level of viral suppression. In looking at the qualitative results, the main theme was that stable housing undermines chaotic and stable housing undermined the chaotic and risky physical environments that residents were experiencing and facilitated service utilization that ultimately reduced HIV risk, improved adherence by enabling people to make giving them the freedom to make the healthy choices they wanted to make. Just to look at some of the specifics. Oh, I got to wrap up. This operated in multiple ways by mitigating exposure to chaos and violence that they were experiencing in unstable housing, and facilitating safer sex, so it reduced the need to engage in sex exchange for survival and gave folks a safe space to engage in sex exchange by choice. So that created an environment, since they live in an individual apartment, where they could practice safe sex, whether they were engaging in sex exchange or not. Not being very articulate. As I mentioned, it helped people to connect to services and manage and make the health choices that they wanted to make. It increased their pride in the living space and the quality of life associated with that lead to positive health practices. I've already mentioned it gives folks control over their living space. They can have friends over. I was going to read you a bunch of great quotes, but I ran out of time. And negotiate the significant societal stigma that they experience due to their gender identity. It also, through the programs we offered at Housing Works, gave them a community space for them to connect with one another and engage in gender-based advocacy activities, including some really important advocacy on the state level for transgender rights. And it gave them a public space in the community for their community as part of a larger Housing Works community. Finally, and we're looking at this separately, transgender identity is often described as in negative terms, but it's not just a barrier to housing and social service access, but we found that it can also be a source of great strength for transgender persons, and that their chosen gender expression encourages attaining health goals. It's their community is a source of support and education, including a support and education around transitioning. That's something that they're doing or going through. And that those members of the community who've gotten engaged in advocacy find that this has been very empowering and encouraged their continuing involvement. So the bottom line is housing is an important structural factor that operates as both HIV prevention and treatment for transgender and gender nonconforming persons living with HIV by undermining the complex risk environment and facilitating positive health behaviors, and that it promotes personal and collective efficacy for the community. So we hope that our model can be replicated, and I think it has implications for replication in many places in the world as a structural intervention for marginalized and stigmatized, all marginalized and stigmatized communities living with HIV. Thank you to our residents and staff, and lots of thanks to the MAC AIDS Fund, who were the only funders who came forward to support this research. Thank you.